Have you ever been told you have flat feet, or you can just tell that your feet roll in or your arch collapses when you stand and walk? And maybe you've been told that this is something you just have to live with, or this is something that you just need a brace for the rest of your life. Well, actually, there is a permanent solution. There is a way to resolve this problem. Hi, I'm Dr. Joel Foster, a double board certified podiatric surgeon here in the Kansas City area. Let's talk about a simple, minimally invasive procedure called EOTTS that could be your solution to flat feet. EOTTS stands for Extra-Osseous TaloTarsal Stabilization. Again, this is a minimally invasive procedure that just uses a very small titanium stent to slip between two bones to keep them from moving excessively. It goes in a little space called the sinus tarsi and tarsal canal that sits beneath the ankle bone or the talus and the heel bone or the calcaneus. By sliding this stent into that position, we can significantly improve your foot position, regain a significant amount of your arch, and significantly reduce the stress and strain that you have with your foot functioning in the current abnormal position. Let me explain a little bit more what I mean by that. So this is the bone called the talus that's part of the ankle joint complex. And this is the bone called the calcaneus, which is your heel bone. And what happens when your foot pronates excessively or becomes what we call a flat foot is the bone is actually, this talus bone is actually sliding forward and over, collapsing down, which is what makes the foot flatten and what makes the leg roll in. The way to fix that is to use a very small little, what we call a stent or a spacer, a little titanium stent, and it just slides right down in that space called the sinus tarsi and tarsal canal, which is a naturally occurring space. So there's no drilling or screwing or anything. We just slide the right size in there. And now when you stand, it lets the foot move, but not move excessively. So we've limited the motion, but not completely restricted the motion, allowing you to function with a much more normal appearing arch and a much better functioning foot. Alternatives to this would be two things: either external orthotics and bracing, which are good non-surgical options. The downside is they do have their limits. An orthotic or a brace is not something that you can use all the time, and a lot of people just don't want to wear them all the time. Anytime you're barefoot, going to the pool, the shower, the beach, all the things that you can't wear them anyway, obviously they're not helping your foot. Also, they're not fixing the underlying problem. Even if you wore orthotics every day for 5 years, you take the orthotic out, your foot's still going to collapse back down the way it was. Surgical options other than EOTTS typically involve major reconstructive surgeries. This is where we lengthen the tendon, transfer tendons, fuse joints, and do something that we call calcaneal or various types of osteotomies, where we actually cut the bones and then shift them over and put screws and hardware. Obviously, that is something you really want to avoid if at all possible. That's what makes the EOTTS, or the Extra-Osseous TaloTarsal Stabilization, such a great procedure, because there's no cutting of bone, there's no sawing, there's no tendon transfer. It's a simple, tiny incision that can be done under local anesthetic right in the office. And you can walk right away. There's very minimal downtime, and there is very low risk because our incision is so small and we are not putting a lot of unneeded hardware in your foot. So what's the next step? Well, we can do this procedure right here in the office. Again, it's a minimally invasive procedure, can be done under local anesthetic with one single injection to numb the region. The incision is 1 to 2 centimeters at very most, and it's done at a very low cost, at only $29.50, so less than $3,000 per foot. We can not only get you functioning better right now and right away, but save you years of potential complications that come with walking with flat feet for the rest of your life. If you or a loved one is struggling with flat feet, EOTTS may be the simple, effective answer that you've been looking for. If you think we can help, please give us a call, check out our website, and we'd be glad to get you in for an evaluation to see if we can help.